Welcome to another episode of Invigorate Your Business with George Stroumboulis. On today's episode, I get to sit down with Dr. Steve Rallis here in Athens, Greece. Dr. Rallis is an internationally recognized authority on IV vitamin C and the supportive treatment of cancer. He's a passionate clinician, researcher, and educator. Dr. Rallis also helps oversee one of the largest IV practice groups in Canada as its chief medical officer. We get to jump into his book, which is called When Oranges Become Apples. And he's gonna talk about everything we need to know about this IV therapy and dealing with cancer. So enjoy this episode starting now. My name is George Stroumboulis, and I'm extremely passionate about traveling the world, meeting new people, and learning about new businesses. Join me as I sit down with other entrepreneurs to learn about their journeys. This episode of Invigorate Your Business starts now. So we are sitting here in Athens, Greece.
Amazing.
With a fellow Canadian we had to meet over here.
Amazing.
It's kind of worked out great. We missed each other a couple of weeks ago here. Got to come back. We're sitting down. Gave me more time to read your book. We're going to jump into that. But I'm sitting with Dr. Steve Rallis. I'm going to read a little intro for the listeners, okay? We're going to talk in detail about a lot of things, about health, about diet, about cancer. We're going to talk about just things that we can do better as humans to try to live longer is essentially what we're doing. Your entrepreneurial background, stuff that you've done. We're going to talk about farming in Greece and olive oil production and just kind of that legacy that you're carrying on. Just really cool stuff. So Dr. Steve Rallis is a distinguished expert in integrative medicine and oncology, renowned for his work in intravenous IV vitamin C therapy as a complementary approach to cancer treatment. He holds degrees in both chiropractic and naturopathic medicine, having earned his undergraduate degree in biological sciences from Western University in London, Ontario, Canada. His chiropractic degree from Parker University in Dallas, Texas, and his naturopathic medical degree from the Canadian College of Naturopathic Medicine. He is also the Chief Medical Officer for DRIPBAR Canada. He's a speaker, an author, an advocate for just being healthy, living a healthy life. He's a farmer, as we said, and he's probably one of the best good-looking doctors around. So welcome and thank you for joining the podcast.
Thanks, George. This is amazing to be here. And I sort of said this, I filmed a little Instagram sort of story on my way here. To do this in Athens with you is just so cool. It's so cool. And, we've been discussing this for a while. And interestingly, I had dinner last night with my cousin, Costa Triantos, Peter's brother.
Okay, small world.
Right.
Yes.
So, and you probably didn't even know that Peter was my cousin.
I didn't know until we were having drinks with Peter before the episode, and he had mentioned his connection with this uncle that he loved up by Wasaga.
Sound, yeah.
Owen Sound. And I'm like, who? And then when he said that, I'm like, come on, that's my brother-in-law's buddy. It was just crazy. Full circle.
It is crazy.
Yeah. But this isn't about Peter. This is about you, right? Obviously, I've known you over the years, right? You, your family. And in my household, in my parents' household, it's always been like Dr. Steve. And it's always, my parents go up and my mom, pulled her back out. Or my dad has this and it's always, okay, let's ping Steve. Let's go to Dr. Steve. Let's see. And you've always been that, like just in our household, guiding medical, light for our family, right? Including my sister's family and my brother-in-law. Like, it's just incredible. And you always have this approach on, I'm going to fix it. I'm going to help you guys. I'm going to give you the information. You make your best choice. So it's just really cool seeing what you've been able to do over the years. So thank you for that.
Oh, my pleasure, man. Your family is, I've said this a million times. They're beautiful people.
I really appreciate that.
Your mom and dad give me the warm and fuzzies, like just beautiful people.
I really appreciate that. Maybe we'll grab a bite to eat after this with that.
Sure.
Right? So I flew in today, LA, New York, Athens. And on my flight from LA to New York, I had your book with me and I've been sitting on it for a few weeks, right? And I was excited to read about it. I've been seeing all the press, seeing you hitting the road in New York and going all over the States with your son, Marcus, who's here. Shout out. Just really seeing that dynamic father-son, which we could talk about later as well, like really cool. But the book, When Oranges Become Apples, I was pushing it off personally because I'm not a medical geared person in that I never try to learn about medical procedures. When I hear stuff, I'll always call my sister and be like, hey, can you dumb this down for me? And she's not a doctor, right? So this one I was putting off because it just kind of scared me, talking about cancer. Then you go down that rabbit hole of like, do I have it? I don't even want to know. But I started, and after the second chapter really just like pulled me in, because now I'm like, oh, okay, I learned vitamin C, IV versus oral. And what does that mean? And then the next step, and then preventative, and then this. And then by the end of it, I'm like, that was a very easy read, right? So we could talk more into detail, but rewind, talk about just your medical journey, because you have covered a lot of bases over the years.
Yeah. It's hard to even contemplate from where I started to where I am now, sort of function as a chief medical officer for a large company, and, having a practice that focuses on integrative oncology, to the research that we do, to we are one of the only clinics that does integrative medical rotations for medical students. And to think of where we started, and how the journey is so circuitous. And, one thing I always like to say is we always overestimate what we can accomplish in 1 year, but wildly underestimate what we can accomplish in 10. And there was a point in the growth of the practice where I stopped pursuing business goals. And I decided to focus on the art of medicine. Didn't matter where it would lead. All I knew was that I wanted to be better. I wanted to learn more. Wherever I met a roadblock, I would either engage in education or further training. And if that meant going back for another 4 years of medical school, if that meant doing a prescriptive authority or learning how to do IV therapies, it didn't matter. I wanted to jump those hurdles because I felt the demand, and I felt it first actually in my heart. And I was led when I stopped sort of focusing on goals, and that, the practice stopped being about, setting goals and accomplishing goals. It was really about treating people. Mm-hmm. And as my expertise grew, the level of sickness of people that I was seeing also sort of that demand increased. And how I got to integrative oncology, I try to articulate that a little bit in the book, but I really don't, because it's hard to sort of pinpoint how I got there. Right. But ultimately, this book is based on the research that we did with Trinity School of Medicine. And we had sort of done a large study on looking at all of the meta-analyses of assessing IV vitamin C with chemotherapy. And there's so much ignorance surrounding integrative therapies and supportive cancer care, like in general. But when it translates to cancer, the blind spot is massive. And the issue is that people's lives are really at risk. Right. And there's so much that you can do, and people have no idea. And the book, I wrote in 6 weeks.
I wanted to ask you that. That's 6 weeks?
I wrote in 6 weeks. Now, we had already accomplished the research. I'd already done the research, the literature reviews. Right. That was fresh in my head. But I wrote it. I spent most of the time actually on editing. I actually wrote 290 pages in 6 weeks. Jeez. But edited it down so that everyone could understand it. Yeah. In really simple terms. And when I originally started too, there was friends that said, why don't you get someone just to help you write it? Like, you're busy.
Yeah, get your ghostwriter, crank it out.
You've already done the research. They can kind of just tell them what to do. They can piece it together. And I said, I can't. The story has to be mine, because only I'm sitting across from the patient telling them things in ways that they can understand. Yeah. And when you articulate that and then they don't understand, you re-articulate it, and then you see the lights go on. So each chapter and each paragraph and each sentence really has been vetted. It's been vetted through sort of clinical practice, where you can sort of share an idea and it makes sense.
Can I give you an example? What made sense with me? Early on in the book, you gave an example about chemotherapy. You kind of go and kill everything. And the, analogy you gave, it was basically throwing a grenade in a room of 100 people, hoping to kill the one terrorist. It was something along that. I probably butchered it.
No, you didn't. You got it.
But for me, I'm like, oh, okay, now I get it. You just kind of go in there. That's how ignorant I am at 43 years old just about this. And the other reason why I was saying I didn't jump into this book, it's because most people, when they're faced with like stresses and bad news, that's when we all scramble. Like, what do I do? What's the quick fix? Right? Touch wood. I haven't been in that situation and hopefully not. But yeah, the way you break it down was great. And then, you know, the stories, and then when you were in Ecuador and just breaking it down really helps it resonate with your average reader, which is myself.
Yeah. And one thing, can I share some of the stories?
Yeah, please.
People really don't understand how IV therapies work. So one of the benefits of having become the chief medical officer for DRIPBAR Canada is that I was asked to be on the sort of founding scientific advisory board for the American IV Association, where we write basically policy papers for all of different states, nursing boards, licensing boards, to help explain IV vitamin therapy and IV medicine and just in general. And over and over again, especially as IV therapies and vitamin IV therapies become more and more popular, people assume that they understand it, or that oral vitamins are the same as IV vitamins, and they're not. They are so different. And part of that title was actually from part of the research. One of the literature reviews we did was that essentially that, and this isn't sort of to like, you know, spill the beans, so to speak.
Right.
But when you hear vitamin C, you think oranges. Yep. You think antioxidants. That's what we're taught. That's what your medical doctor was taught. The vitamin C is an antioxidant. It's one of the most powerful antioxidants. And it's just true. So if someone is having chemotherapy, as an example, which is an oxidative therapy, it's the exact opposite. Why would you want to take an antioxidant which would be negating the benefits of that oxidative or pro-oxidative therapy? And what's missed is that vitamin C, when administered intravenously at high dose, changes from being an antioxidant to a pro-oxidant. And people don't know that.
Right. And sorry, you break it down in there too on what the level is. People trying to dismiss it. Well, we were testing orally and it's the 80 versus the 300. Like, just talk to that. So,
okay. So so that's really important. So the assumption is that we're taught, and our medical students are taught, that essentially most small molecular weight drugs, which includes like most vitamins, fall into that category of small molecular weight drugs, like vitamin C. So the assumption is that most small molecular weight drugs follow first order kinetics. First order kinetics very simply means that if you double the dose of the drug, you double the dose in your bloodstream. That's just first order kinetics. If you double your Advil, doubles the Advil in your bloodstream. Mm-hmm. Vitamins, however, don't follow that. So vitamins are very, very tightly regulated. So vitamin C, as an example, has a resting concentration in your bloodstream of about 80 to 120 micromolars. And in the book, I sort of describe, and I say this to my patients, because you say micromolar and already
over. Yeah. Right.
So I said, you've got a pitcher of lemonade. It's 1 liter. If you take 10, and you want to sweeten the lemonade, and you want to add some sugar. If you add 10 granules of sugar in that 1 liter of lemonade, that's a 10 micromolar concentration. 10 micromoles, 10 granules in 1 liter. Mm-hmm. If you added 80, it would be 80 micromolar. So the concentration of vitamin C in our bloodstream is 80 to about 120 micromolar. Now, we test vitamin C on most of our patients. That number is actually a lot lower. It's actually less than 80 for most. So vitamin C does not exert a therapeutic effect unless it crests 300 micromoles. So it would be like 300 granules in that lemonade.
All right.
It has no therapeutic effect. So here's the interesting part. So when you look at pharmacokinetic studies, when we say pharmacokinetics, again, patients will sort of gloss over, but pharmacokinetics is just basically how a drug behaves or is metabolized in your body, how it behaves when you take a drug. So if you take vitamin C orally at high doses, no matter how much you take, you could take it 1 gram, 1,000 milligrams every hour, 2,000 milligrams every hour. No matter how much you take, vitamin C will never exceed 220 micromoles per liter.
200, but you need 300 for it to be
therapeutic.
Therapeutic, okay.
Has no therapeutic effect. So the original vitamin C studies was actually done by Linus Pauling. And there was a Scottish surgeon by the name of Ewan Cameron who was treating end-stage cancer patients with vitamin C, IV vitamin C. And Linus Pauling, who was a 2-time Nobel Prize winner, and again, there's only 4 2-time Nobel Prize winners ever in the history of the Nobel Prize. This is like the pantheon of scientists. Yeah. And Linus Pauling found Ewan Cameron's research very compelling. So he decided to participate. And they decided to do a study. End-stage cancer patients at that time was patients that had less than 2 months left to live. Okay. So they took a group of 100 patients. They compared it to 1,000 controls in the hospital in Scotland. They gave them 10 grams of vitamin C IV every day for 10 days. And then they gave them oral dosing after. And those patients lived on average 200% longer. And for end-stage cancer patients, that's a big deal. Absolutely. The study was published in 1976 because Linus Pauling was attached to this. This created some stir. Anything associated with Linus Pauling at that time moved the needle. So, but it moved the needle in a positive way and also in a negative way. So the whole sort of, natural medicine, vitamins, the naysayers were out there as well. In fact, there was a lot of sort of blowback from this community. Now, Linus Pauling being sort of, on the Mount Rushmore of scientists, was actually unfazed and found some of the feedback to be positive and said, we can redo this under tighter controls. To test it further to see. Yeah, so they did. They redid the study. And what they found was even better results. They were living 380 days longer than the cohort. Wow. Which is massive. And that second study was published in 1978. And at this point, you would think now, however many years later, how is it that we're not using IV vitamin C as a complementary therapy in the standard of care? We say the standard of care, chemo, radiation, or surgery. Right. Not to replace it, just... Sure. How are we not using it? So in the book, I say enter Charles Myrtle, the original, the OG quackbuster. Okay. Guy who hated everything associated with natural medicine, was working as an oncologist at the Mayo Clinic in Rochester, Minnesota. And they decided to redo Pauling and Cameron's study. And it was shamefully published in the New England Journal, 1980. And these studies are still out there. You can read them in their entirety. And gave the patients 10 grams vitamin C, end-stage cancer patients, against a control, and it had no effect. Because? Was it oral? Because it was oral. Yeah. It was administered orally. And he published it in the New England Journal. Yeah, which is the standard, right? Which effectively shut down the discussion of IV vitamin C in cancer. Well, okay. Vitamin C in cancer. Pharmacokinetic studies were not published until the mid-1990s, which Linus Pauling knew, he just couldn't explain it. And years later, we know now, no matter how much vitamin C they would have taken orally, it would have exerted no effect therapeutically. They're not hitting that 300. Not even close. Oh, okay. The dose required to have an impact for cancer is around 10,000 micromolars. Wow. Okay. So when my kids are taking these little sugar cubes of vitamin C, that's not doing anything. Nothing. Totally unrelated to cancer. I'm just saying it's doing nothing. In fact, really all oral vitamin C does is it prevents deficiencies. Doesn't exert a therapeutic effect. Okay. So it's not building up your immune system in any way. Okay. It's supporting the immune system in a general way by preventing the deficiency and raising that micromolar concentration, but really has virtually no effect. Gotcha. In fact, if you're going to take oral things for your immune system, you'd be better to focus on certain botanicals that act more as whole drugs that you can take orally that would affect the immune system in a different way. Versus vitamin C. Yep. Vitamin C would be useless orally. Gotcha. Back to this myth buster, this quack buster. Yeah. So they come out, they publish this, it kills the whole momentum that they were building. Momentum. So where does the industry go from here? The industry basically went, like most sort of natural medicine practices basically went underground and was continued to be practiced by doctors and clinics, went offshore. It's done in Germany, done in Mexico over the years. And we lost so many years. And partly this research too was done when I was originally contacted to do the consulting work in the US for the IV vitamin C. Vitamin IV therapy, especially in the US, is the Wild West.
How so?
Because it's regulated, but no one has any idea of how to actually do it. Like, so when you talk about osmolarity or concentrations or what's safe or what's not safe, people have no idea. Because doctors that are administering it, or nurses or nurse practitioners, were never trained in IV vitamin therapy or vitamin therapy in general or nutrition in general. So they have no clue. So when I looked at the original high dose IV vitamin C formulas by a president of a company that was interested in having me consult for them, they said, "What do you think of our formula?" And I said point blank, I would never administer this in a patient.
Because it's not effective in any way, or
no? It's because it wasn't constructed properly.
Just mic drop. Walked out of the room.
Yeah, and I reached out to me and said, "Would like to hire you to do it." So because it wasn't administered properly, they didn't take osmolarity. They didn't look at normal saline versus sterile water. They didn't look at accompanying electrolytes like sodium, magnesium, calcium, potassium, and it puts the patient at risk. So you're having these companies that are just hearing high-dose vitamin C and just administering it, but not administering it safely.
For the listeners, we're not stepping away from the cancer conversation because there's a lot to talk, but before you even focused on vitamin C, IV therapy, and cancer, you were always into the IV therapy in general, right? Yeah. Different vitamins. So just talk to me the importance of that, even for being proactive and healthy and replenishing. Like, how did you start that? And then how did you get contacted by the US to start consulting in this space? I'm just curious on the progression.
Well, so I guess from a naturopathic medical perspective, like you're using vitamins all the time to treat disease. So naturopathic doctors have a really broad scope of practice. In other words, they have prescriptive authority for drugs. They understand vitamins and nutrients. They understand nutrition. They understand all of these other therapies. So you can tailor make a patient's protocol. So you begin to use, so let's say someone comes in, or let's say from a chiropractic perspective, patient comes in acute back pain. So instead of, and anyone who's had acute back pain knows they don't want to be touched.
Right.
So the idea of a chiropractor trying to wrench their back into position is terrible. So what ends up happening is, so the patient would come in, I would start an IV drip, add in magnesium, add in some calcium, maybe add in some potassium, and then you begin to see that their muscles begin to relax. So then you can provide therapy.
Okay.
Patient comes in with anxiety. And let's say we've already done blood work on this patient. We know that their folic acid is low or copper is high. Copper is high drives dopamine to norepinephrine. So they become even more anxious. So you can add zinc to that IV. You can add magnesium. You can add glycine, which is going to be affecting the GABA receptors. So you can take a patient that's having an acute anxiety attack and using these nutrients intravenously, you're able to administer or have an effect that you would never have with oral dosing.
Gotcha.
And moreover, because it's instant, again, small molecular weight drugs are tightly regulated, which includes magnesium, which includes zinc, which includes calcium. You can then begin to affect their affect, in this particular case, whether it was anxiety. So when I began to sort of see these over and over again in practice, and then we were also treating cancer patients, and oftentimes it was the tail wagging the dog. Patients were coming in knowing they wanted high-dose vitamin C or knowing they wanted mistletoe.
Oh, really?
Yeah, and it wasn't until I was as skeptical as everyone else. Like, okay, I mean, I guess.
But were they coming in saying, hey, I'm going to get cured by doing this, or it's going to provide some comfort during this process?
Yeah, I mean, I don't know. I mean, everyone's hoping for the best, but no one really, like in terms of the actual providers, no one really talks about cure.
Right.
Right. The issue with cancer is that it's such a devastating disease that we don't even talk in terms of cure. We talk in terms of 1, 2, 3, 5 year expectancies, life expectancies. And that's why I feel like it's pretty rich when an oncologist who takes like a really lethal form of cancer and tells the patient not to do anything else, when they know their standard of care is good for about 6 months.
Jeez. Which is the norm, right? You're seeing that a lot. So when you have...
That was the impetus for the book.
That was okay.
And let me backtrack. It was the impetus for the research, which became the impetus for the book. Because if a doctor says, I don't want you to do any supportive therapies, and the patient's life is on the line, and chronic disease, the management of chronic disease, which includes cancer, even though it's an acute form of that, requires, and I mentioned this in chapter 1, a systems biological approach. The issue with our medical model is that it's based on an infectious disease model. This idea of one cause causing one disease, and one cause, one cure, right? And so in an infectious disease model, cancer, the tumor is like the pathogen. So you need to kill the tumor cell. The issue is that killing the tumor cell doesn't kill the stem cells, doesn't kill the triggers. And oftentimes that stem cell just repropagates the cancer. The cancer comes back even more aggressively in 2 years, 3 years, 1 year.
This is a very important point, what you're saying right now.
It's a massive point. Yeah. So what we're understanding that in the systems biological approach, you have to look at the disease along multiple fronts. So how the cancer fuels itself.
Right.
So the cancer will use 2 fermentable fuels. It'll use sugar or use glutamine. So glucose or glutamine. So if you can strip the body of glucose, glutamine's harder because it can pull it from muscle. But if you can, then it will shift. And that's why when you hear of nutrients, like let's say berberine. Berberine is a plant medicine that's found in like golden seal or hydrastis. It gives it that yellow flavor. It's that yellow tinge that's really bitter. It's an alkaloid. But berberine makes sugar less tenable to the cell. It downregulates sugar. And that's why you can use it in metabolic diseases like diabetes. You can also use it in cancer. If you look at metformin, which is a typical drug that's used for diabetes, it's not a hypoglycemic, but it's used for diabetics because it drops so it makes that tumor, when used in cancer rather, it makes that cancer cell less able to use the sugar. And then if you induce a ketogenic diet, as an example, or periods of ketosis, tumor cells are not very good at using ketones for fuel.
And ketogenic diet is low
fat, low carb, high fat, low protein.
Gotcha.
People assume the ketogenic diet is high protein. It's not.
It's not. Okay.
It's not. It's a high fat, and tumor cells are just not very good at using fats as fuel.
Gotcha.
And then you can again affect all of the different pathways. So there's an inflammatory component to cancer. So you can use things that downregulate inflammation, like low dose naltrexone. Naltrexone's used typically for heroin addicts, but at low doses, it affects a lot of chronic diseases, including cancer. So again, you can do low dose naltrexone. You can use metformin. You can use curcumin. You can use, and if you begin to sort of like, it's death by 1,000 strokes. If you begin to sort of affect all the different pathways that are affecting that tumor cell, it then becomes starved and it raises the oxidative capacity so it can be crushed.
And the stem cell as well?
And the stem cell.
Okay, which in traditional chemo, they're not even worried.
Not even addressing it because you can't. In fact, the chemotherapy, which is effective, doesn't affect the stem cells at all because chemotherapy only affects rapidly dividing cells. The issue with that, which is great because tumors are rapidly dividing, but so are all your bone marrow cells, so are your white blood cells, so your immune system goes straight down.
Right.
And without your immune system, the immune system is what does the final kill in cancer. And if your immune system's compromised, the patient's compromised. And that's why stem cells just regenerate, they're not screened. And in general, like any young patient that gets cancer, effectively it bypassed our immune vigilance, right? So our immune system, and that's why, right? And that's why the immune system has to be affected. And in the future, the cure for this, so that the vision is that cancer just becomes a chronic disease. So you live a long and healthy life.
Like HIV is what you're mentioning. Yep.
And effectively, you will find a combination of metabolic ways to strangle the cancer so that it can't grow, immune components so that it affects and is able to see those cancer cells. And when you get this sort of combination of metabolic and immunotherapies, the cancer will just basically shrink to nothing.
But can you explain so the listeners know, like HIV, where was it when it first came out and where are we today?
So it was a death sentence, right?
Like Magic Johnson today is living a long life.
So we grew up under it was HIV became AIDS was a death sentence.
Yep.
And eventually we now control it with a combination of 4 drugs that basically renders it useless. And people can just live long and healthy lives even with HIV.
You could spread it, but it's still...
It's manageable.
Yep.
Like any chronic, it just becomes a chronic disease management.
So you're saying that's where cancer could lead to?
That's where cancer is going to go.
Okay.
I'm sure of that. But as long as in oncology, if we fall into the trap, so the best research tells us that we have to apply the systems biological approach. But if we fall into the trap of looking at it as one cause, one cure, we're screwed.
So all these cancer institutes, let's talk about the US, right? You have some numbers in there where, am I saying this right? Every day there's 5,500 plus new cancer patients every day.
Something like that.
Something like that. And every day in the US, roughly 1,500 people die from cancer every day, right? And we have all these cancer. Anywhere you go in the States, even the smallest town, there's a cancer center, there's a cancer center. I mean, start getting cynical, but these are operating on a for-profit basis, right? So does a systematic approach go against them? Like, for me, it makes sense that they wouldn't support this because they wouldn't be in profit in business.
Yeah, I mean, I don't know. I don't think it's as nefarious as that. I don't think it is a for-profit, but I just think that they're looking for the best available research. So the best available research in an infectious disease model is the most effective therapy. So chemo kills a tumor cell better than anything else, but you lose when you think it's just chemo. So for example, like I talk about in the book, the research, so some of the most lethal forms of cancer, high-dose vitamin C works most effectively. So as an example, if you took colorectal cancer, which is on the rise, and you see colorectal cancer in very young people even.
So just colon cancer.
Colon cancer.
Okay.
30-year-olds we see in the practice with colorectal cancer. So, and KRAS positive. So we were taught, and all medical students today are taught, that cancer is a genetic phenomenon, which isn't true. Because you could take the exact two types of cancer, the exact same types of breast cancer, let's say, and they will have multiple genetic variations. So each breast cancer will have multiple genetic variables. So the genes are not predeterminate. So some of the most lethal forms of cancer have certain genes that turn on, that basically trigger this cancer. So KRAS positive colon cancer is an example of that. Okay. And very poor outcomes. Even with the standard of care, which is combination chemotherapies. And yet, if the studies that were done that used high-dose vitamin C first, outcomes are better. And why? The glutathione, which our listeners will know is sort of our body's main antioxidant. It's the body's most powerful antioxidant. And tumor cells are chock full of glutathione. And high-dose vitamin C, because it's an oxidative therapy, depletes the glutathione in the tumor cell. So if you do high-dose vitamin C first and then do a chemotherapy, the tumor cell is so weakened that it becomes obliterated.
With chemo, when chemo is administered. Okay. But what you just listed, that process right there, is that the norm or no?
Again, because they're looking at the best available evidence, which is based on an infectious disease model, which is looking at one cause, one drug.
Right.
And it was the same thing it was the same mistake. So like we had a patient that, let's say, that had a weakened immune system, and shaving her legs gets a staph infection and then gets cellulitis because her immune system's compromised for whatever reason.
Sure.
Let's say she has a metabolic disease, diabetes, etc. She then develops cellulitis. She's given antibiotics. But we find that when we give antibiotics plus high-dose vitamin C, the outcome is way better. So the patient responds to that same standard of care remarkably better. We saw that in COVID. Same thing. High-dose vitamin C, you'll get a better outcome. So you see this over and over again. And not surprisingly, even with cancer, if you couple it with stuff like doxycycline, which is a very normal, sort of a typical antibiotic. Okay. A lot of antimicrobials seem to impact cancer. And again, when you couple them with high-dose vitamin C or artesunate, another example, from wormwood, which is used for malaria. Ivermectin, another one. Mebendazole, which is it's the human version of fenbendazole, which is a dewormer. And all of these seem to impact cancer, but not on their own, but when coupled. And the mistake that everybody makes is, again, falling in love with this one cure model. And you've got to get that out of your head.
But this is what I'm not understanding. Are they threatened by the one cure? Because you're saying, keep doing what you're doing. This is in addition to, if we could start it earlier on in the process when you first discover there's cancer. But why is there pushback? Because they're going back to that study that basically debunked this?
No, I don't even know. I actually think they're going back because our research models are fundamentally broken because they're too simplistic.
Okay.
That's the issue. It's kind of like when you hear the best prevention for the flu is the flu shot. That's a preventive strategy, but what if we looked at that with vitamin D levels, with zinc levels, with immune levels, with metabolic status, with it's when you begin to look at, and it doesn't matter with flu because by and large, people for the most part aren't going to die.
Right.
But with cancer, unless you begin to pull it apart and look at it systematically along its entire continuum, you have to address all of those points. It'd be like running a business and saying the most effective thing is just this and forgetting everything else.
Absolutely. Absolutely. Where, when you're doing this and a patient comes to you, what's the best type of scenario if someone discovers they have cancer, early on? Because this process to even see a difference takes several months, right? It's not a quick fix. Hook me up to an IV, I'm good.
Right.
This takes work, right?
Right.
It's definitely a few months for someone to get on a program. When is it just too late?
Basically, when their immune system, and we see this all the time, we've had patients that came in and were effectively scared out of treatment by their oncologist, and with very lethal forms of cancer. And sadly, they'll come back 6 months later and completely depleted from the cancer or depleted from the chemotherapy. Their cancer's back. And at that point, there's very little you can do. It's just palliative.
Jeez.
And again, the reason I'm doing this today with you is for awareness. People don't know. And here's what the viewer fundamentally has to understand, that modern cancer therapy requires that you understand the cancer in its entirety and you strip it down. If you have a major problem, you have to peel it apart.
Right.
And look at how is it driven? How does it get its fuel? What's the inflammation level like? What's the metabolic status like? What's the genetic component? What's driving it? What's the health status? What's the immune status? And unless you address all of those things, or from a positive perspective, if you address all of those things, including the standard of care,
right,
the outcomes are always better. They're always better. There's simple studies like fasting before chemotherapy reduces adverse effects.
Really?
And improves outcomes. Why? Because you can imagine if the cancer is primarily driven by sugar, and this, I always find this so, I don't know whether it's rich, infuriating, that when an oncologist or an oncology team says that it doesn't matter what you eat. Oh, doesn't it? Because when we're screening patients, so if we think that a patient, if we find prostate cancer and we want to see if it's spread, we give them radioactive sugar, give them PET scan, and wherever the sugar goes, it lights up, tumors light up.
There's the answer, right? So
Right.
Obviously, yeah.
So if it doesn't matter what you eat, it matters to the tumor. They certainly like it.
Right.
Right? So then I think if you can't, so when you say it doesn't matter, everything matters. The example that I use is the David Brailsford example. And this idea, the 1% rule, and I won't belabor it, but look
the British cycling team example.
The British cycling team example.
But it's basically every day you try to be 1% better, or over the year, just be 1% better.
Or begin to add all of the little things added together have a magnitude of effect that are greater, sort of the synergy, they're synergistic. The magnitude is greater than the sum of their parts.
Right.
So you begin to see, like in the Linus Pauling studies, that the patients that should have expired at 6 months, 12 months are still thriving. You know, and I used several examples of that in the book, where patients came to us at end stage or given 6 months to live,
right,
or 4 months to live, and are still alive. And you don't promise that.
Okay, I was just going to ask you, like, when they come in, what are you telling them? Because
you just tell them in very simple terms, like, here's what we can do. We address the metabolic components. We address the inflammatory components. We address the immune components. We try to improve quality of life. That's all we're trying to do at this point.
Right.
And when you begin to sort of couple all of these therapies, you begin to see effects. And you have very clear and delineated markers. So we're looking at blood work, and we talk about that in the chapter. And again, not to make it complicated, but to explain it to people and patients in very simple ways. So if they understand exactly what the metrics of success are, then they can understand if they're winning.
Right.
And if the therapy is effective. Like, you do not want to invest in time, money, energy on a therapy that is not working.
Plus, you're dealing with emotions. You think your world's coming to an end. Like, people are vulnerable. Like,
and the population's vulnerable. And they're vulnerable also to hope, which is not a bad thing, but you do not want to be selling false hope.
Right.
You want to give the patient very clear and delineated markers. We are either hitting these targets or we're not.
So you're bringing this out, right? You're creating this forum, this discussion, you're touring. It makes sense. Where do you see the market adapting this? Like hospitals, the medical boards? Is this something that will take decades for people to say, no, this makes sense? Are you confident today with everyone you've treated with this, that it's working, it's making sense? You're able to change some of these markers with IV therapy?
Yeah, and nutrient therapy and diet. And again, I sort of go through an entire metabolic approach so that I can explain that.
Yep.
That I'm not putting all of my eggs in one basket, and you're trying to make the standard of care, the chemotherapy, radiation, more effective, less toxic. You're trying to help the patient get through that. You're trying to address their immune system because their immune system is becoming compromised. So we can see that even in neutrophils to lymphocyte ratios, which is a normal white blood cell panel. Mm-hmm. And again, I'll tell the patient very clearly, if your neutrophil to lymphocyte ratio is greater than 3, your risk of death goes up significantly. If ALK-Phos, which is a marker of destruction, goes above 185, or lactate dehydrogenase, because the cancer cell is using preferentially glucose, which goes to pyruvate, doesn't go into the mitochondria. There's lab markers for all of these.
Right.
And interestingly, here in Greece, they run RGCC panels. This country runs RGCC for all the doctors, integrative doctors in the world, which looks at the cancer along all of the different components, circulating tumor cells, stem cells. So we never tell patients that you're cured, right? It's like, what's the burden of disease?
Okay.
Right? So then if you can bring it down so that, and again, we use examples all the time. I just had a patient do a consult last week, cervical cancer last year, quote unquote cured, ring the bell.
The bell ringing.
1 year later, it's back with a vengeance. Now it's metastasized and gone everywhere.
Jeez.
In all the lymph nodes, into the lungs. Metabolic markers were never checked. Inflammatory markers were never checked. Circulating tumor cells were never checked. They dropped the ball. They're not checking. They're doing gross markers on a CT, and it's not enough.
Right. I know you can't get controversial, but from the American versus Canadian medical system, is it similar when it comes to this arena from cancer?
I would say that what I've noticed in Canada, like most of the boards that I work with in terms of supportive cancer, integrative oncology, IV vitamins, are mostly doctors, MDs, or medically trained MDs from the US.
Right.
Canada, I think because of our Medicare model,
yep,
they're just in their silo.
Right.
There's actually less collaboration. Whereas in the US, part of the benefit of it being for profit is they're open to exploring things that may improve outcomes and thereby improve the viability of their outcomes, practice, research, etc.
Gotcha.
So most of the the feedback we have from MDs are from the US, although we do have Canadian doctors as well.
Yep.
And Canadian oncologists that are understanding this more and more. It's just that there's a lot of hubris in medicine, and that keeps them oftentimes blind to research that they're not privy to.
Do you read any of the hate comments? Since this book's been launched now a couple months, officially a few months. Do you go down the comments?
I don't.
Yeah, I guess that's a good thing, right?
I don't. Just because I'm so sensitive that when you're authentically trying to do something to improve a person's life, like it's your brother or your mom or yourself.
Yes.
Like what would I do? Right? Or it's, I take that type of trolling, I can't read that stuff.
Yeah. You're almost better off. And you're not trying to sell a miracle drug that you can only buy from Dr. Steve in his practice.
No.
This is a system.
Moreover, our research is designed to, and there's a lot, and I don't even want to take credit for any of this. I'm just trying to do my part in sort of furthering this, both from an education perspective and a research perspective. But, there's people that have done a lot of research and are continuing to do the research. And the more we collectively put our brains together, but the truth is, if the model with which we view the disease is fundamentally broken, which it is, you're never going to find the cure.
Right. Absolutely.
That's the problem.
Yeah.
And, looking at immunotherapy is great, but it can't be just immunotherapies when there's metabolic components that are driving the disease. So you have to look at, again, a systems biological approach that this genetic somatic mutation theory that's been attributed to the cause of cancer has not provided a fruitful outcomes in terms of life expectancies or outcomes. In fact, I mentioned this, that the person who proposed the somatic mutation theory for cancer never actually studied cancer.
Really?
Yeah.
So I want to ask you, there's someone in my circle life, right? I don't want to name names or like what the relationship is, but prostate cancer, right? I feel like we've talked about this going on 2 years now. Is it the PSA?
Mm-hmm.
Okay. PSA has increased a little and hasn't changed his diet at all. Sodas, sugars, nonstop. Number keeps rising, hasn't done anything yet. And it's like a certain stubbornness where you just want to shake the person. I feel like this type of therapy right now, before it gets out of control, is perfect to start looking at his numbers, right? Start applying vitamin C IV therapy and looking at this. It's just, patients early on that have this seems like it's ideal to start administering this.
Yeah, for cancers, we know the earlier that you can detect, the better the outcome.
Right.
And that's why early detection is so important. And it's hard for us because in general, we don't even, like you said this at the beginning too, it's a heavy topic. Like you almost don't even want to talk about cancer.
Right.
Like you don't even want to bring it up because there's some dumb luck associated with it. But the more we can early detect, the better. And in your friend's case, the more you can get that PSA. And again, we don't even know exactly the correlation between PSA and even later stages. A lot of the drugs that we use to sort of affect prostate cancer, which are androgen blockers, stop working.
Okay.
They stop working. And unless you have a broader systems biological approach that is providing positive outcomes, those patients are at risk.
Right.
So you're right to that point. You should be addressing the disease as early as you can.
Yeah.
And as aggressively as you can.
So give us some advice. You had mentioned, diet, keto diet, fasting.
I'll give you some great advice.
Now, just before you give that, I'm always paranoid. I fly a lot. My exposure to radiation, like there's so many things, cell phones here, like things that we can control, but we don't. But what are the things that we can control?
The things you can control in terms of cancer drivers for sure are metabolic markers. So, and we look at this as metabolic markers and metabolism just in really simple terms. Means basically how our body uses food for fuel. And the canary in the mine shaft is almost always insulin. So the first thing you should look at is fasting insulin. for everybody,
Okay.
including yourself. Look at fasting insulin. And I give the sort of the markers, the reference markers. So the markers we use in our normal lab panels are for the normal population. The problem is our normal population is not very healthy.
Right.
So there are optimal markers. So in the Canadian markers, it would be, let's say, less than 45 picomole per liter. So if you have a fasting insulin level that is high, then insulin is a nutrient storage hormone. So basically, insulin takes sugar that's in the bloodstream and puts it into the cell. So high insulin drives disease. It drives inflammation and it drives disease. It drives all diseases.
So when you're saying high insulin, like when you're eating breads, anything that will spike your insulin.
Right.
Okay.
So when you eat, insulin is released. And then the size of the carbohydrate load results in higher insulin. So people that have huge meals or eat too much sugar or have soda pop 18 times a day will have phenomenally high levels of fasting insulin. It will be a precursor or driver for all diseases that are metabolically driven, including cancer, including heart disease, including diabetes, including et cetera, et cetera, et cetera. You then look at inflammatory markers. Two simple inflammatory markers that are dirt cheap are sedimentation rate. Sedimentation rate is basically you take a test tube, you spin it, the rate at which it creates a sediment implies whether there's inflammatory components in there. The range is 2 to 20 or 2, depends on the lab. 2 to 20 millimeters per hour. In other words, the rate at which it creates a sediment. You shouldn't have inflammation. So low-grade inflammation, again, is a metabolic risk factor for all diseases, including cancer. C-reactive protein is another non-specific inflammatory marker. Higher the C-reactive protein, especially if it's low-grade inflammation, the higher your risk. And with cancer patients, we always see inflammation goes up, and as inflammation goes up, risk of death goes up. When we can get inflammation under control, the patient gets under control.
Okay, so it's correlated.
So those are 3 simple tests that if you can look at your insulin. And again, when patients come in, it doesn't really matter whether you're overweight, underweight. If your insulin is good and your inflammatory markers are great, that's the first thing that you can do. The second is looking at your immune system. An immune system requires this sort of cascade or balance between a lot of things. Things like vitamin D, like zinc, etc. Vitamin and nutrient levels, antioxidant status. So, fasting is the great equalizer.
Yeah, talk to me about this, because
fasting resets everything.
But how long? Because I know people now that are doing weeks at a time, or someone will do 8 hours, and is that even fasting, or is it just called sleeping? Like, what's a good rule of thumb for?
In general, what ends up happening is when you stop eating. So our body's main exposure to the outside world is through our gut, right? So most of our immune system surrounds our gut, because you can imagine that our environment is what kills us. So if you take something from the outside world and put it into your mouth, how potentially dangerous that is.
Right.
So naturally, our immune system is mostly surrounding our gut. So it screens everything and it's highly vigilant. And that's why when you overeat, it impacts or recruits so much of our immune system that our immune system then becomes compromised to affect other things.
Gotcha.
So when you fast, your immune system can then respond to healing. But in general, how it works is once you stop eating, the glucose that's in your bloodstream goes down. Glycogen, which is the storage form of glucose in your liver, gets pumped into the bloodstream. When it then depletes, your body then goes, oh shit. And then it shifts. It goes from using a glucose dominant fuel source to using fats or ketones. Once that shift occurs, your immune system kicks to another degree. And really, you just have to get to that state.
But is there a rule of thumb on, I know everybody.
Yeah, so the rule of thumb is if you fast for too long, you're then depleting, you're stripping your body of protein. So you'll get a reduced net effect.
Okay.
So you have to fast a certain amount and not enough to compromise your natural immune status.
And is it a daily thing? Like I know you talked about 16 and 8. Was that?
Yeah, I think that there's a balance. Like at no point in our human history were we exposed to constant food. So our operating system has existed mostly in a fasted state. For our entire human history, we've been mostly starving.
Yep.
And when we starve, what we realized is, and I use this example of one of our cancer patients, Amanda, in the book, who had cervical cancer that had recurred. And she was very characteristically had high fasting insulin and high inflammation. And what we saw after that first dose of doing high dose vitamin C and chemotherapy and mistletoe therapy, she got good results on her scans, but her labs, it wasn't gone, and her labs were still total shit.
Okay.
And that's when I sort of read her the riot act, that it really, until insulin goes down, until inflammation goes down, we're not out of the woods. And that's where the patients sort of lose their vigilance. They're like, oh no, this looks good. The tumors are shrinking. Everything's coming along.
And they just keep eating the way they were.
Right.
Yeah.
And that's where I even said she would be like vomiting in the room from the chemo. And even from high dose vitamin C, she would come in so sick. And when I first broached the subject of fasting, reducing adverse effects related to chemotherapy, like her and her husband, like she goes, I can't, like she became defiant, I can't do that. And her husband jumped in and said, no, she's right. She can't do that. Like she has to eat all the time. Of course she has to eat all the time, because if she stops eating and insulin levels are high in the blood sugar goes down, so you get hungry. Right? So it wasn't until it switched, she started eating in a different way. Her fasting insulin went from 170 plus down to 45 or below 50.
Right.
That in the scan was no evidence of disease. Then the chemo and the high dose vitamin C and the mistletoe and the supplements and all worked completely in synergy. That's how critical the diet was.
Right.
Like it made every therapy more effective.
And what were her results? Like
Phenomenal.
At the end of all this?
Still alive.
She's still alive.
And she was given a year to live.
Am I making this up, or you mentioned in the book the fact that her husband was in the room and they both said that she can't go without eating? You said something along the lines of, well, that's an indication that you need to address it.
Right.
Right? Like we shouldn't be hungry all the time.
No. Because where were we wandering with constant food?
You weren't killing deer every minute and had meat and had,
So we were meant to, and your body gets to the point when you begin to fast, like the first sign of illness, like just from an immune perspective, first sign of illness, stop eating. Like throat scratchy, stop eating. Period. Stop eating.
Oh,
That's a great rule.
Okay.
You know, like, because your immune system, your body has an inherent healing mechanism and you have to unleash it. The way we unleash it is through sleep and by not eating. And we eat to support our body and our immune system so that we can replicate protein, so we can build muscle, maintain bones, get our nutrients. But beyond that, we're meant to fast. And we know that because even the way our minds function neurologically, ketones, like the moment you're hungry, you can't think.
Right.
But when the body switches into ketosis, our brains can run very effectively on ketones, and you can think clearly. And oftentimes our best thinking is done once we're in that state, which is completely different, you know, and most of us are just sick because we're constantly fueling our bodies and our body can't actually heal.
Do you fast?
I do.
Like I feel like you need to have a spouse if you're married or have a boyfriend, girlfriend. You need a spouse that supports that as well, right? You kind of need to be on the same page. Don't you find that?
Yeah, for sure. But for me, even just for my work, it was easier. It's easier for me to fast during the day.
Yeah.
And I'll have a protein shake that I'll make. But again, I'll make it fat dominant with some protein, but not high protein. And, again, there's this movement towards really high protein now, the same there was and it's not about the high protein. It's enough protein.
So not the carnivore diet, breakfast, lunch, dinner.
Yeah, I'm not finding the best, and I'll have lots of patients that want to follow the carnivore. But I'm not getting the best lab results with patients that are using the carnivore. Same way that I'm not getting for patients that were vegan.
Right. So what is it? There's always trends. There's always stuff coming on. Is it just follow a good Mediterranean diet?
A good antioxidant rich diet, enough good quality, healthy proteins, real food, and limit that food so that the nutrient value of your food is at the highest caliber at the lowest caloric amount that you need to sustain yourself and sustain the immune system, but enough so that the body can heal. That gives yourself the biggest fighting chance.
Right. I think it'd be great for the listeners, blue zones. Can you talk a bit about your knowledge on, like, I think it's Icaria here is one of the blue zones.
Yeah.
Like what do they do different?
Well, it's funny we talk about the Mediterranean diet, but the original Ansel Keys studies from the 1950s, they looked at Crete.
Okay.
And people's idea of the Mediterranean diet is so fundamentally like skewed. Like Crete in the 1950s, protein was, like, my parents had meat 3 times a year.
Right.
Right? Crete at that time, first of all, they fasted around Easter.
40 days.
40
right?
days.
Yeah.
Meat was wild rabbit and fish, mostly. Botanicals, surrounded by botanicals. Even their honey was botanically grown.
Right.
All their teas were botanicals. Their grain sources were all very rustic. You know, like rye, barley, very rustic grains. Their dairy products, antioxidant rich. All of their vitamins, all of their fruits, vegetables were locally grown, and olive oil was fresh, and the caloric intake was actually very low. So that diet is not what is people are fed in terms of, like, or what the versions of the Mediterranean diet are now. In general, people eat way more than they need to.
Right.
Way more. And if you could strip down your caloric load and increase the nutrient value to the highest level, that's your best fighting chance.
But it's so hard, especially in North America. I mean, Greece is no different here, but it's so challenging just with the life. Everyone's working. We're working long hours. We're traveling. We're doing all this stuff. Junk food, especially in California, is on every corner. I've never seen a more concentrated area in the world for junk food, fast food.
Yeah, I think the secret is just to basically, you have to hold yourself accountable. And I think that enjoy those restaurants, enjoy chefs, enjoy celebrating food, because we should. It's in our operating system to overeat. People fundamentally lose that idea. Like it's in us to overeat. We're meant to gorge.
Feast or famine, right? Just
feast or famine.
Yeah.
So if you can appreciate Thanksgiving dinner, then starve up to it.
Right.
And then your body's healing, then you gorge, then you starve, and then you gorge. That's inherently how our operating system works.
So we need that reset.
It's the reason why if you open up a bag of chips, it's gone.
Yeah.
I don't eat 4 chips.
No, I don't think anyone on this planet.
They're gone. The whole, like, if it's the size, it's gone.
Yep.
Because that's how our brain is operating.
Absolutely. So this is incredible. We're going to put the links up in this book. Everyone should read it. I'm going to get several copies. I have so many friends that I want to read this, right? And I think up till the first few chapters, it's just so packed with information. Talk to me about the DRIPBAR, Chief Medical Officer of DRIPBAR Canada. So is DRIPBAR, what's the plan? It sounds like this is going to be an expansion and there's going to be a DRIPBAR on every corner type thing.
That's the hope. I mean, it's a way to sort of standardize IV therapies across Canada. We have an incredible medical team of medical doctors, nurse practitioners that help sort of oversee and facilitate these franchises. And it's such an untapped opportunity in Canada because the IV franchises are actually way more well developed in the US.
Okay.
And in Canada, it's completely untapped. So it's really first to market.
I've never done an IV in my life, aside from maybe I was in the hospital and they put just an IV for that. Yeah. I've never done IV vitamin therapy in any way. There's several in California. So just what is the process? You go in, you get your blood work done first. And then
Canada, the way our model works is that we do a screening, and DRIPBAR is partnered with Revive, which is the largest IV provider in the world. There's a Revive actually here in Athens.
In Athens, okay.
And so the Revive has a screening tool, and what we do is we do labs as well in Canada, and then from there tailor an IV and custom formulate IVs for the patients, and then they have their IV formulas, and then it depends again on whether there's an immune component, whether they're fighting something, and again, then we also have health-related IVs like high-dose vitamin C, for supportive cancer or for certain immune components or viruses, etc. Alpha lipoic acid, mistletoe therapy, NAD for brain injuries. So those all get kind of tailored and are either referrals from other doctors or from the patient, but we sort of use our medical team to sort of custom make these formulations. And the thing that I guess I'm proudest of is that, I had a prominent role in sort of creating all these formulas, both in the US and in Canada.
These formulas are basically 10 typical issues someone may have, administer this. Okay.
And they were built out of clinical practice of actually using these formulas and seeing the result with patient and now standardizing these across Canada. And again, so it brings me great joy to see this now unfolding across Canada and the US and really around the world. Separate
brands, DRIPBAR Canada and the US, are they separate entities?
Same ownership.
Okay.
Although it's a subset, it's a different company, or it's a subset of the US franchise in Canada. But the R&D team that we're part of is really for the entire company.
Gotcha.
And our R&D team is global.
Yeah, that's exciting. It makes me, honestly, I want to start, especially after reading this. I just want to start. I feel like I
me
need
too.
it.
Even when I'm, before I travel, I'll do glutathione, or I'll do, even vitamin D, doing it intramuscularly as an injection at 50,000 IUs. I remember when I first started practice, and I prescribed 2,000 IUs of vitamin D for a patient. And I got a note from a doctor saying that I'm prescribing something that's going to cause liver toxicity. And, that there's so much awareness required for this. And that's what this is really for. But seeing these formulas now and these processes and protocols now becoming standardized across the world is just very compelling for me.
Yeah, absolutely. And you are a speaker, you host different events, you speak at different events, not just in Canada, around the world, from Ecuador to Germany. Just talk to me about that. That's a big deal. Where are you finding the time to even do this?
Yeah, I don't know. But I'm trying to sort of move my practice so that we do have a team of doctors and nurse practitioners, and naturopathic physicians that can help facilitate this.
Yeah.
Right. So that I can do the teaching to them. And most of the teaching that I do is to other doctors.
Which you need to. You're one person who's doing amazing things. If you're stuck in one physical location, you can do more change for more people by kind of quarterbacking.
And for the viewers watching, I want them to sort of pick up on the fact that let's have conferences here. Like we were talking about Costa Navarino. That's a killer place for people to come and do that and train European doctors from Germany, from England, from et cetera. Because there's such a demand for this.
Yes.
Such demand. And you mentioned earlier about how does change happen? And fundamentally, change always occurs from the ground up, not from the top down.
Right.
Medicine is not going to change. The same way that, media didn't change. Social media happened, which changed media in general.
Right.
In the same way that all change occurs from the ground up. So patients demand it, people demand it, and then eventually the system will change to facilitate the demand of the patients. Absolutely. So that it will become standard. They will want to know, how do I eat? What supplements do I take? Are there immune system things that I should do or shouldn't do? And it's important that people become educated, because a lot of times patients are doing things that are actually deleterious to their cancer treatment or to their heart disease or et cetera, because they fall into trends. And we don't want this to become a TikTok phenomenon where it's about one thing.
Right.
It's about looking at it systematically. So that's kind of it in a nutshell.
Yeah, and you're talking about stuff you're an expert in, you love it. So it's just so natural. Shout out to you, working with your son during this too. I think that's so cool that, right? Last month, you guys were in New York, you're doing a tour, promoting the book, and your son's there, and you guys, he's capturing media, he's part of this. I kind of joked before we started this, it's the equivalent of us helping dad at the restaurant.
Totally.
Right? Except this is kind of a cooler thing to do, and he gets to see the world. How cool is that?
And we're not getting bacon burns.
Yeah, exactly. Grease fryer. That's just so cool.
Yeah, it's amazing.
Yeah. So I guess on time, I want to talk quickly about the farming, the olive grove, carrying on your father's legacy. I don't want to butcher the story. but your father, great man, has done great things. You and your brother were his life, right? All this stuff. And, every year he'd still come back to the village and he would harvest the olives, make olive oil, and just do that. Just talk to us about just growing up, doing that, starting the business with your brother, and then carrying on this legacy.
Yeah, my dad passed away last year, which, it was had loss. No, is that you can't, it fundamentally hits you on such a level that you can't even really comprehend it. And it's interesting because it was then, we were coming back for the olive harvest, but we were running I would come for 5 days or 7 days, or I never took time away from the practice.
Right.
When he passed away, I said, screw it. And I said to my brother, we're going to do the whole thing from start to finish, however long it takes. And whatever the cost would be to our businesses, because it was so important to carry on that legacy. And being here for that length of time, first of all, everything slowed down. So the process of doing it changed me. What we do, when we originally did it. So when my dad said he took the groves over from my aunt who was farming them when he decided to come to Greece full time. And he said that, and I said, look, all that really matters is early harvest, or make sure that they're organic. So you don't want to be bringing back olive oil and feeding it to your grandkids who were little at the time if they're full of pesticides.
Yep.
Right? So, and because pesticides and all toxins are stored in fats, including food fats, olive oil becomes that much more impacted.
Oh, okay.
Right? So in your cells, the reason a lot of time when people begin to lose weight, they feel like absolute shit is because the moment you lose fat cells, toxins are mobilized.
Okay.
Right? So people have an inability sometimes to lose fat because they're so toxic. So fats naturally absorb toxins, including from the environment. So I said it's really important that the farms become organic. It's important that it's an early harvest because the antioxidant levels are going to be higher. It's really important that we press it as cold as possible. And my dad, like a dog on a bone, said, okay, because he loved his grandkids. He knew that this oil was going to be for them.
Did you have a commercial angle at that time? Or
I thought that whatever we don't use as a family, I'll share with my patients.
Yep.
And again, you're not going to share olive oil with your patients that is full of pesticides or fungicides or is shit, right?
Yeah.
So again, he like a dog on a bone, he went from press to press to press. And presses in Greece are paid by yield. So they actually didn't want to press it cold. They want to press it hot because you get greater yield.
Yep.
And found a new press that was starving for business. They said, yeah, I'll press it whatever you want. And at that time, so it was being pressed around 35 degrees Celsius, 40 degrees Celsius, cold press. We pressed it around 6 degrees. Oil was phenomenal. Sent it to the chemist in Messini. And he looked at it and goes, this is great oil. Antioxidants through the roof. And then my brother got involved trying to find a way to press it colder and colder still.
Can you define cold press versus hot press?
It's a loose definition. It's actually based on acidity of the oil. There is no real standard definition of cold pressed. It's a loose term because historically when olive oil is pressed mid-November, it was done in cold water stone mills.
Gotcha.
And it's just pressed cold.
Yep.
But now it's not pressed cold. It's actually pressed hot. It's still called cold pressed.
But you're still getting a bigger yield when it's hot.
Yeah.
Okay.
So we actually try to actually press it cold. Right? So it produces less, but really doesn't matter.
Yep.
Because the quality is higher. So yeah, so then we kept trying to make that better and better, developed a following. And, I think, for me, it was never about the commercial part of that. It was really that process of doing it gave me a window to a world I never could have imagined. Like farming, and first of all, olive oil farming and olive oil business is the most corrupt business. It's it would probably rival cocaine.
Globally, not in Greece. Oh, yeah.
Not in Greece.
Oh, absolutely.
What makes Greece actually very special is that when I'm in the village farming, they're like, what's a doctor from Canada doing? But they know now. Obviously, right?
You had a line last year that was like nailed it. And we'll talk about this. Finish your train of thought, because I'm not going to.
Go ahead.
You had a line. It was you and your brother Theo documenting this. And again, we'll chat about that. But you said something that this is like the only country in the world where everybody has their profession, doctor, lawyer, policeman, accountant, but nearly the entire country is a farmer. They have some sort of, there was something like you were referencing. Right.
Which is, and there's so many village presses, not commercial presses, like they're commercial, but not like olive oil, like the commercial stuff that most people get their olive oil from. So you can imagine, so if my cousin Tasso, who's an electrician, he's working on the house today with his brother Costa, and they haven't got to their olives yet.
Right.
But they're going to farm. So the electrician's farming. The pharmacist, the coroner, goes and farms her olives. And you have an entire country and economy of these really half-ass farmers, but it keeps the food source pure.
Absolutely.
Which you would never have. Can you imagine, like, in Orange County, if everybody produced their own food?
Right.
So like the pharmacist said, look, I gotta, at CVS goes, I've got to get to my,
avocado trees,
my avocados, and, I got to get to my almonds. I got to do. And when we were kids and we were comparing North America versus Greece always seemed so ass backwards.
Right.
And yet it's like by accident, it's figured out that it's hard to monopolize that now.
Yeah, that's a good point.
Right?
That's a really good point.
You still see food here that's actually food.
They're trying to change that with everything slowly, but you're absolutely right. There was summertime, I'm at the Mandarin Oriental with my family, just grabbing lunch. The waiter, shout out Dimitri, we're talking, he's bringing us pizza or whatever. And where are you from? I'm from Khalkidiki. Where are you from? Well, my family, Kalamata, best olives in the world, blah, blah, blah. Oh, yeah. What about honey, meli? I go, yeah, we have that too, man. The best in the world, right? Just whatever. He goes, wait. He goes to his car, parking lot, comes back. He has his own jar. This is the waiter at a very nice, expensive.
Yeah.
He goes, try this and tell me what you think. And the guy gives it to me. I remember taking it back. And I'm like, the pride. This guy's a waiter at a 5-star resort. We're talking about this. And then he's telling me about his father and his grandmother do this. Like, that's Greece, man. Like, it was just such a cool moment.
Yeah. Like
he got fired later. No, I'm joking.
No, it's totally, that is Greece in a nutshell. This is a very special country. And the areas that farm are connected, to source in such a unique and profound way.
Right.
And the sad part is that, we're here in Athens and everybody leaves the villages to come to the city, to chase a life, to ultimately get to a quality of life that is almost inherent in the village,
Absolutely.
And connecting to food. Like, I used to think my grandfather's house was so poverty, which it was, had an outhouse.
Yeah, same.
But it had a pomegranate tree on the property, and an orange tree, and an almond tree, and a lemon tree, and a fig tree, and chickens running around, and milk from the goats hanging, making cheese. And I thought that was impoverished. And can you imagine, like, I can't imagine a better definition of wealth. And it's attainable and livable, and yet we're on a treadmill chasing things and a quality of life that if we just took a step back, you could see that it still exists and exists here.
Yeah.
And most people are becoming blind to it because, again, they've fallen into the Californication of what life actually should be.
Absolutely. And that's why you and your brother need your own TV series, documentary. Not joking. So last year, the first year since your father passed, you and your brother come back and you're like, all right, guys, we're going to do this. Right.
Yeah.
And you know what? We're going to give daily updates on trials, tribulations, the shit that we were fed today. Right. And I'm telling you, like, my sister and I would be like, did you see Steve's update today? No. What's going on? Like, I'm not even saying it. Like, it was so, first of all, it was magical, right? Because, right, I love my father. I'm very close with my father, as are you. So, like, I see that dynamic on just, like, so much respect for your dad, right? So you have that aspect, but it was also comical because, like, you guys are figuring it out and you're like, I didn't know this. And then the sun, like, there were so many elements to it where I'm like, that's such a show. And it's not just for Greeks outside to watch this. This is anyone that has some sort of immigrant family. There's some sort of farming element related to every country. Yeah. Whether you're from El Salvador or Italy or wherever it is, I genuinely think, and you guys are both business professionals, doctors, have careers. And you said, you know what, we're just going to put our life on pause. It's just such a cool thing that you're doing. We need to document that.
We should. If my brother and I don't have a blowout in the meantime, but.
No, but that's good TV, man. We'll feed that fire too, just so you guys, like, you know, fist the cuffs in the middle of it. Yeah. But it's really cool. So you're doing this now, aside from your own, like, Rallis olive oil has also won awards. It's not just like a hobby, like, it's an amazing product.
It is. And my brother's sort of the most to sort of, like, he gets most of the credit for that because he's the one that sort of tried to more commercialize it as a business. I had no interest in doing it as a business, actually. Yeah. And I'm not sure that I even still do. I'm more interested in having people explore that on their own in a way and find ways to source real food. The same way that I'm not interested in getting more patients for high dose vitamin C. I'm interested in teaching other doctors to do it.
Right. It's a movement. It's not absolutely a movement.
You know, and I think that if the more we do that, I think that, you know, man, if you taste olive oil fresh from the press, there is a handful of people on planet Earth that have tried real olive oil straight from the press as it's coming out, and it's so green, it's so peppery but amazing, and you taste it with, like, on a piece of orange or some bread. It's like, it's so next level. Yeah. And you begin to realize then where the health benefits come from. No different than, I went to the market in Kalamata, right? And just picked up, like, to make my own little snack balls for work. So I got almonds, walnuts, dates, nutmeg, cinnamon, some cashews, all fresh, all local, so that the walnuts aren't rancid, and put them in a blender with dates. So some walnuts, some almonds, some cashews, ground up the cinnamon and the nutmeg, all grown locally for dirt cheap. Blend it, add some olive oil, fresh olive oil, make my little protein balls or whatever you want to call them. And the taste.
Jeez, that sounds delicious right now, man.
The taste is out of this world for dirt cheap.
Right.
And you go and buy these sort of concocted bars from food from God knows where. It doesn't even taste good. And then people are like, I can't even eat healthy. Of course you can. It doesn't taste good.
And even the healthiest one is jam-packed with fructose and all these syrups. And
So, and again, not very complicated. You know, like, I went to this really high-end restaurant and I came back from Greece. I landed on a Thursday, went out for dinner on Friday. And you know, when you come back, the jet lag, and you're just like, and I'm just like barely keeping it awake for dinner. But we had, my wife had planned this dinner sort of, and we were at a really sort of high-end restaurant and known for the calamari.
Back home in Canada.
In Canada. Yep. So they bring it out and like, you know, how is it? I'm like, yeah. You know, so 3 days before I'd been at the market, the calamari had come out of the ocean. Took it to my mom's house. The olive oil we had pressed that night, the lemon was from her tree.
Jesus.
There is no comparison. Like, there is no comparison. And I'm not a chef.
But these are the things, the older you get, the more you appreciate. We haven't even talked about water.
And and to that point, it cost a fortune in that restaurant. It was dirt cheap here.
And top quality.
Straight to the water.
Yeah.
Pressed that night. The olive oil was pressed that night. The lemon was from the tree, right? So, yeah, I mean, and then water, on top of that.
Just the water in Greece. It's just high in minerals. You know, it's pricing is standard. It's set by the government. So you can't charge more than 50 cents if you're buying the small one.
Right. Or euro for the...
Yeah. And back home, like I've become a water snob. Actually, I would love to ask your opinion on this. Just water in general, the little research I've done and what I've heard is, purified water is just horrible for you. Is this accurate?
When you say purified, what do you mean?
Purified of just like, a Dasani purified water that basically is stripped of all minerals and nutrients.
Yeah, like reverse osmosis generally.
Yeah, just purified.
Because you've lost the minerals.
Lost versus like a mineral water. So
right.
A lot of the airports I go to, it's like Aquafina or it's Dasani. And I'm like, I'd rather not even drink water if it's doing that. But grease by default has so many things. Let me ask you just like final comments. Where's Dr. Steve Rallis going in the next decade, 20 years? Like what's your legacy? Where are you going?
I think research and education, for sure. You reach a part in your practice where you need to inform other people to teach them how to do things and also to continue to learn, because it also puts the bar on me so that we're not sitting stagnant. And I think even in terms of, from a lifestyle perspective, where I'm going is closer to here. Less is more.
Yeah.
I find it when you're at that little coffee shop in the village and he makes this like dynamite espresso or a macchiato. I usually order a macchiato, for €2, and he gives you the water. And you go to Starbucks back home and it's total shit.
Yeah.
And you charge you $8 and ask for a tip.
Yeah. By default.
By default, they ask for a tip.
Yeah.
It's shit.
Yeah.
And this guy, it's $2. I give him $2.50. He doesn't want the 50 cents.
Right. Yeah.
He sees me every day. He doesn't want it.
Right.
I'm like, take it.
Yeah.
Right. And I want to be around people like that really sort of take pride in every single thing that they do. We were talking about this the other day. We were in Java, and the guy who makes his ice cream makes every single ice cream in there. It's his job. And, it takes so much pride in that.
Doesn't matter the position here. Like you see so much pride in that.
Right. There's pride in every single step along the way. It's not just entry level. There's no such, like, that's not here.
Yeah. Yeah.
And
people take that step further, I find. Yeah.
Right. And if you apply that to, it's like if a patient has pitting edema because they're having congestive heart failure, and I'm inspecting their legs and I'm checking I put their shoes back on because they're old and they have congestive heart failure. And it's like the little thing versus like, put your shoes back on.
Yeah.
I was having an ultrasound done at an imaging center, and she just like squishes like the cold ultrasound and then threw me a towel, like clean yourself off. Like,
you feel dirty, and I'm like, I didn't even do it.
Yeah. And it's like, where's customer service gone?
Yeah.
And no one, I think that you have to, and this is sort of like, I know that this is off topic, but service is about caring. And I guess because we grew up, being grateful and working hard, you realize that you try to treat everybody. And that comes back to the point. When I get a negative review, I'm devastated. And I'm devastated because I care. So where did it go wrong?
Right.
Why did it go wrong?
But a lot of the times these reviews are by people that are just, you know what I mean? I don't think I've ever written a negative review online. If I've ever had an issue with something, and it's very few times, sometimes I'll just be like, it's not even worth it. It's like, hey, why don't I give that feedback in real time? I hate online reviews. It drives me nuts personally. Like you have someone who has a restaurant and you found a hair in the food, for example, right? Not great. But like you go online and you're trying to take away money out of their pocket and ruin their image. Like there's a time and a place for it, but we've gotten a little keyboard happy, I think.
We do. And I think that it's, yeah. And I think it takes courage and authenticity to reach out to the owner, the proprietor, and say what's on your mind.
Absolutely.
Yeah, I agree. We have become keyboard happy.
Yeah, you're not going to have negative reviews. I mean, just delete them, right? This has been awesome, man. So The links we're going to put online anywhere books are sold. We're going to go Amazon. Yeah. Amazon's the main one, right?
Yeah, I think it's up on Barnes and Noble. I think it's on a bunch of different ones, but it's available to a bunch. But Amazon is the main one.
The main one in the States. I got it off Amazon.
Yeah, in the Canada, in Europe as well.
Yes.
And I do highly recommend anyone who's going through that. Like, shout out to Jane McClellan, who is a stage 4 cancer survivor. She wrote a book, How to Starve Cancer, and she articulates a metabolic approach to treatment of cancer. I recommend it to every single one of my cancer patients.
How to Starve Cancer.
How to Starve Cancer. And her updated version is And Kill It with Ferroptosis. But I wrote this book for our patients. So that they can understand the process. And anyone who's going through that, and even someone who wants to sort of just understand even IV vitamin therapy, it's useful to your point.
Yeah.
But yeah, so I appreciate you. I appreciate the shout out for the book too.
Absolutely. And last question I have for you. If someone is based in Texas and you're in Toronto, for example, or someone's in New Zealand and they want to get in contact, you can't really treat from there, right?
No, but we're creating an integrative oncology arm that is going to be North American wide and hopefully global wide. And we have created a not-for-profit called DRIPBAR, which is going to be providing high-dose vitamin C to cancer patients at a reduced rate.
Nice.
And it's a not-for-profit corporation that we've started in the U.S. and that we are getting clinics now coming on board to offer this to patients so that they can get these type of therapies at a reduced rate.
Amazing. What does a 3-month cycle typically go for? Or is that just a loaded question?
No, I would say you're typically going to pay, I would say $200 to $250 for an IV treatment. So if you can imagine, it really depends on the type of IV, but that's going to be a 2 to 3 hour treatment typically for anywhere from 50 to 75 grams of vitamin C.
Oh, so you physically have to be there for 2 to 3 hours for this drip to do what it needs to do?
Yeah.
Okay.
Generally, it's done twice a week. Some clinics will do 3 times a week. Generally, we don't find much different outcomes at 3 times per week.
Yep.
Typically, we'll say because of the nature of IV vitamin C, you'll have to do 16 to 20 treatments first, try to couple it with the chemotherapy, and then see if the patient's a responder, which using those metrics.
Yep.
And then from there, you can begin to tier it and structure it depending on what the outcome of that initial trial of care is.
Gotcha. And if you're looking at $2,000 to $5,000 for a 3-month,
it's very cheap medicine in terms of cancer treatment.
That's what I'm saying. Like, if you're
really cheap medicine, and that's why they typically, like even mistletoe here in Germany, is Medicare covered.
Okay.
So we're not there in North America, but I don't think we have to be. It's a relatively inexpensive therapeutic.
I feel like Mark Cuban with his whole cost plus might be able to...
That'd be amazing.
Right? Shout out Mark. Don't know him, but I'm sure we could get to him.
That'd be amazing.
Awesome. Dr. Steve Rallis, you're the man, dude. Thank you so much.
Thanks, George.
Thanks for listening to this episode of Invigorate Your Business with George Stroumboulis. Please hit the subscribe and like buttons and follow me on all the main podcast streaming channels. Also, please share your comments when you can. I appreciate your help in expanding this network to a worldwide audience. Until next time, stay invigorated.